So let me tell you a little bit about our speaker today, for those of you who may not have seen the introduction online. Our speaker today is Dr. Cliff Porter. He is a family medicine and urgent care physician here in Austin, and he opened Texas Direct Medical Care back in November of 2019 based on the direct primary care model. He's going to explain that to us today and talk about the benefits of that. In terms of kind of what he brings with him to the table today, prior to his current practice as a medical practitioner, he was medical director for Community Care's 2 walk-in clinics in Austin and served as an Army physician at Fort Hood until 2017. And today he still serves, so thank you, part-time as the flight physician for the Texas Army National Guard's Aviation Brigade. So welcome, Dr. Porter. We're excited to hear what you have to share with us today.
All right, thanks, Sherry. I recognize a bunch of people here, and we've been to a couple of different networking groups. Physicians, we don't usually do networking groups, so developing a new model, it's going way out of our comfort zone. I tell people we don't take a class in business in med school. We take a class in how to write badly. So we're really quite good at that. But I'm going to share the screen. I got about a 12 PowerPoint thing, which kind of introduce the model. And then, by the way, feel free to ask questions as we go through this. Also about COVID. I've been very early on actually in researching and actually treating COVID in the outpatient environment. So I know there's a lot of questions on that. But in a nutshell, direct primary care is a membership-based primary and urgent care model where we don't bill insurance. So it's just a membership-based, and that takes care of everything. And I'll explain a little more as we're going through, but I'll just start real quick with the big picture of what problem we're having in medicine. Let's see, there we go. The problems, it's getting more expensive. There's lots of reasons. Healthcare is getting worse in a nutshell. So direct primary care is a significant alternative. I only learned about this about 2 years ago, actually. About not even quite 2 years ago, and you know, I've been in medicine for a while, and I didn't understand it. And there's other alternatives to major medical coverage. I do direct and urgent care, but I don't have an intensive care unit in the back of my clinic. Dr. Frankenstein and I, that's a little reference to Young Frankenstein. We're coming up with some plans, but don't tell the Texas Medical Board. But in a nutshell, there's some better options for us. You guys may have seen this. Premiums and deductibles are going way up. It's shifting the cost from insurance and healthcare to the individual. That's why these deductibles you see are getting far more expensive. Most care is done at lower than your deductible cost. So you end up just paying more for a lot of stuff. Oops, went the wrong way. There we go. So you'll see in this one, depending where how your screen is, the administrative costs has just skyrocketed in medicine and healthcare. HIPAA, EMTALA, which has to do with emergency rooms having to required to see everyone immediately, ends up being just more and more burdensome costs. There's a variety of gatekeepers in the system. There's things called the pharmacy benefit managers. They're actually the in between big pharma and retail pharmacy. They actually require to get paid off. They have this legal, essentially kickback scheme. They don't like to call it a kickback, but they got an exemption from the anti-kickback law so they can get kickbacks. And so prior authorization, all these things are adding to cost. One last thing on the bottom there, capitated reimbursement. This will explain why this model works better for you and me, not all the gatekeepers and middlemen out there. Basically, most practices are paid per person they see. It's called capitated by the head, which leads to an old joke. Harvey, this is for you. Decapitated reimbursement is what assassins get, but capitated reimbursement. So what does your doctor have to do? He has to see as many people as possible to get paid. So what happened to your appointment time? How many of you got 5 minutes to go see your doc, and then you have to move on? So that's why that occurs. So the results, bad medicine and higher costs. So when you go in to see the doctor, you wait because might have a high copay, high deductible. You wait till you're really sick. Especially men, they never want to go see the doctor until their wife makes them. You wait till you're really sick. You don't want to pay that extra cost. If you're going to go see the doctor, you don't want advice. You want to get a prescription. You want to get your money's worth. So what happens when you wait so long? Now people are going to the ER. They're going to hospitalizations because diabetes, hypertension is not controlled. And so we're getting worse medical care. So this, I came across this line a number of years ago. Your health is a monopoly against yourself. And so, your health is your wealth, right? And so people take advantage of that, and people fear the catastrophic costs and so end up paying more and more. So what are you left with? And Mitch knows this best. High deductible health plans. I think it's 16.3 thousand is the highest deductible on the ACA plans this year, but I see regular people $5,000 to $8,000 deductibles. Then there's higher premium, really nice Cadillac plans, but those can be ridiculously expensive. Or you can just go self-pay and hope for the best. So for individuals and businesses, like if you own a business, you want to pay for your people, but if it costs too much, they're going to go join one of these big companies, Tesla, Dell, because they're going to get better benefits. All right, there we go. So new options. So direct primary care. This is a much better way to do medicine because in a nutshell, people pay a small membership fee. You see, my fees are about roughly $80 for an adult, $200 for a family per month, and that pays for everything. So I don't do capitated reimbursement. So if someone needs something, it can be handled over the phone or text, email, video chat. We just do that. There's no copay to collect. I don't have to bring people in to generate charting to bill insurance. And so we can handle things simply. A mom emailed me a couple weekends ago about her kid's diaper rash. So I just emailed her back, start with this, and if it doesn't work, let me know. Didn't have to do a visit, didn't have to take time off for work, didn't have to go see it. I've seen my share of diaper rash. So we were able to handle everything just by email. So that's all taken care of. And then, I also explicitly tell people I do urgent care. So if you sprain your ankle, come see me. Actually, what I can do is, you sprain your ankle, call me. I'll arrange to get an x-ray. I pull the x-ray up on my computer, and you can all do this from home. And then I can see if it's sprained and you just need to wrap it up and put your feet up on your desk or your boss's desk. Or if you have to come in and I need to splint it. If it's a hairline fracture, you don't need to see an orthopedist. I can take care of it. And that costs you nothing except the membership fee. By doing these things this way, it takes money off the table. And so people can call or email just for medical advice and doesn't cost anything. So it makes things way better. And then we just take after hours and weekends. There's a group of about 15 or 20 of us now in town who are doing this model. And I have a part-time PA. She works with me and comes in and does women's health stuff for me as well. So we're growing, and so people can find the right practice that matches their medical needs and their personality. And then you go on vacation, other people cover for us. So we can actually cover everything at all times. And I can spend 30 minutes with someone. I like to visit for a while. So some of the cost savings. I use LabCorp. I guarantee payment for LabCorp, and LabCorp gives me all the supplies I need. I have an excellent phlebotomist. She does all the blood draws in clinic. Because I do a guarantee payment, LabCorp doesn't have to go after patients. They don't have to go after insurance to get paid. So they give me wholesale cost. It's $3 for a cholesterol check. Copays to go get that done at LabCorp through a lot of other traditional insurance could be $10, $20. Here's a bill that I got actually for a couple lipid cholesterol screenings. And you see how much, over almost $220 is what Humana was billed by LabCorp. I got charged $11.50 a copay. This is Army TRICARE through Humana. These two tests through my lab is $10. So I got cheated out of $1.50 for my copay. That's half a cappuccino. So you see the enormous cost of administrative stuff. By bypassing all that stuff, I just plummet the costs. So other things we don't include, of course, I don't have an MRI in my office, but I get MRIs. There's places around town where you can do cash MRIs for $425 for a full knee MRI, rather than spending $1,500 to $2,000, which is what you're required to pay through certain insurance systems where you have to pay the deductible and you get the max retail cost of the MRI, 3-4 times as much. X-rays, for example. I don't have an X-ray because I can get an X-ray for $50, like half a dozen places around town. I would like an X-ray, but it's $70,000. And then I'd have to have more space for a clinic. I'd have to hire a radiology tech. So I spend $50 for an X-ray is a lot quicker. Things I do in my clinic. Everything I do in my clinic is essentially included, except for extra durable things like a walking boot costs $35 through my wholesaler. So if someone has a really bad sprain or hairline fracture, I can just do that. Crutches, I just 15 bucks. If someone needs a steroid injection for allergies or a joint injection for arthritis, Toradol is like a super ibuprofen, treat migraines. All that's included because I get the cost so cheap through the wholesalers. Epinephrine, EpiPens. He's 130 bucks is about as cheap as you can find it. That essentially the equivalent of 3 EpiPens is 1 milligram vial. It's just $14. So we're trying to get the state legislature to change it so I could actually dispense that out of my clinic. I can do a preloaded syringe for someone who needs an EpiPen for like $7. So you see how we can really dramatically lower costs. So direct primary care, the DPCs, we can bypass a lot of the barriers of gatekeepers and other costs for it. And then all these things help better. Because I can spend time with a patient, I don't have to do as much referrals. Like right now, if you go see your doctor and say, yeah, I feel like my heart flutters sometimes, send you off to a cardiologist. Now you get another pay. I have my own EKG. It costs me half a penny to run an EKG. So that EKG, I can actually determine if it's something that can be handled initially. Like I had a patient who had palpitations. We determined it was just she has caffeine sensitivity. She needs to cut back on the cappuccino or monster drinks in her case, and did not need to see a cardiologist because I can see people same day. I always arrange my schedules to do it. People don't have to go to the ER and spend $1,000, $2,000, $3,000 for a strep throat. Actually, I saw a couple cases where some people went in to get some COVID testing just to get a screen with a test, and it was $6,000. The COVID test that I do out of my clinic, I get a 1-day turnaround, is $70 wholesale cost, and I just charge a $40 office visit fee for non-members. For members, it's free. So you see those tremendous change in costs. So businesses that are adopting this are actually saving an enormous amount of money. There's a hospital in Florida, a small rural hospital that was spending $2.2 million a year in insurance costs. And then what they did is they adapted. They did a combined direct primary care combined with a catastrophic plan through an insurer, and they dropped it from $2.2 million to $970,000 in a single year. So they're able to drop it by just having better care at the beginning. Don't wait till things get bad. And actually, this is from this example, DeSoto Hospital in Florida. And there's some other ones where by doing all these different changes in how they approach medicine, by seeing things, getting things done up front, save a massive amount of money. Burton Plumbing, that's a good example for small businesses. They have about 100 employees. And by adapting the direct primary care, so their plumbers would talk to their doctor first before they go off to the ER, go to the hospital and get taken care of. Hypertension, diabetes, the big ones. 90% drop in ER visits. That's an enormous drop in claims. And then by changing that, now they've changed their whole insurance premiums for catastrophic or major medical care. So I don't have a hospital ICU in the back room, not a surgery suite. So what do? Combined with direct primary care, a lot of people are doing a couple different things. Health savings accounts. Then there's other individualized plans like health sharing plans. Decent Insurance is a new one where you pay for the premium for Decent Insurance. It's a decent plan. That's what they came up with their name. It actually includes membership in a direct primary care clinic. So it's not set for businesses, it's set for individuals right now. But that way, by getting better care, you're just reducing costs. Another interesting one is called self-funded or level-funded plans. And this is where essentially a business puts money in an escrow account on a monthly basis, and they just pay for things as they go through. Someone has appendicitis, they pay for it through the escrow account. Well, what if someone has a leukemia and they have to end up MD Anderson or something like that, and that's a massive cost? That's where you use a third-party administrator and a underwriter for those massive costs, but they're everything else you take care of yourself through an escrow account. And what you don't use comes back to the business at the end of the year. So you use pre-tax dollars that you use for healthcare, and if you don't use it, you got profit. So there's a variety of different ways people can actually get better care for a fraction of the cost, sometimes 25% of the cost, not a 25% reduction, 25% of the cost. So here's I think this last slide. I like to tell people how many slides I have because I hate being in that PowerPoint slide and you don't know if it's 10 slides or 5,000. So direct primary care, start with that as a foundation. And then from that, you can add a variety of different things, high deductible plans, health share plans, or even develop your own. There's companies that do this where they'll come up with a level funded plan for 2 to 25 employees. And now you have better healthcare than some of the big companies have it through their Cadillac plans. So there's far better ways to do it. Also, if you're interested in where some of these places are, there's about 1,500 clinics. 1,500 clinics. Let's see, I'll turn this off. That's DPC Mapper. Nationwide now, and there's about 15 or so here. I may open up a second clinic in Southeast Austin if I get enough businesses to sign up over this next enrollment period. So we'll see how that works. But that's a quick overview of direct primary care. It's a bit of a revolution in how we do medicine. It's a new model, but you can give me a call, spend time. People are stunned when I answer the phone. I'll chat with people. In many ways, it's old school medicine. Much better way to practice and a lot more fun. And it's allowed me to actually be very active and involved in actually treating COVID. So I've had about 40 cases. So I've been able to do a whole lot more, much better practice of medicine, and I can take care of my friends. So there's a quick rundown. Now I'll breathe.
Dr. Porter, thank you so much. Based on a couple of comments that we're getting in the chat, people are absolutely loving the information that you're sharing this morning. I do want to open it up for a little bit of Q&A if you're okay with that.
I saw Harvey's comment. Harvey, God bless you.
I know, right? Harvey keeps us smiling and getting all those positive juices going in our minds.
I put my
Keeps us
info
in
on there.
stitches.
They say laughter is the best medicine.
Exactly, exactly. I saw that Greg asked a question, and Angie, I do see you. I saw that Greg asked a question in the chat. He was wondering if you have a catastrophic carrier that you recommend.
It kind of depends on the individual. The health share plans are really interesting options. There's religious ones and non-religious ones, like Christian Health Share Ministries. It's not insurance, but you share costs. It's kind of like crowdsourced funding for healthcare, but it's organized, and there's some parallels. You have an unshared amount and a shared amount. Unshared amount is what you pay, kind of like a deductible. Shared amount is what the community pays, which is what the company covers. So the guy who embroidered my scrubs, he and his wife, through Christian Health Share Ministries, had cancer treatment at MD Anderson completely paid for. But you do have to sign an agreement that you'll do some clean living. They don't pay for you end up in the ER for mainlining heroin. But then there's non-religious ones like Sedera, Zion, and other ones that give a discount for being a member of a direct primary care clinic because we have less claims. I put a few examples on my website, but it's really going to come down to the person's comfort zone. I don't make money off any of these. I'm not a broker. They just encourage people to join practice like mine. There's my agenda. So there's a couple, and then some people, they take that high deductible plan with a high, $7,000, $16,000. So they have the disaster coverage for the big accident or else, and then they use my type of practice. So a family of 4, throw in an MRI, some x-rays, a few medications. I can take care of a whole family for $3,000 a year. So there's a bunch of different interesting options.
Nice.
So.
Okay. Harvey, I do see your question, but I saw Angie's hand raised a few minutes ago first. So I'm going to let Angie ask her question.
I think you answered it, Cliff, because there does seem to be a gap between what you're doing, which is fabulous, and then there's the catastrophic. A lot of the MedShare programs do cover both, and so I didn't know and wasn't aware if there were just catastrophic insurance coverages out there, with a $7,000 deduction that's just going to do your hospitalization, your cancer, and not an AFLAC or a
Right.
Heritage program, but because then that would be a good complement and a good fit, because what you're doing is brilliant. And if that's what you know, we were doing, we would not have this healthcare problem we have now.
Yeah, there's Mitch could probably explain a little better some of those different high deductible type options, which are de facto a catastrophic plan. So people aren't financially destroyed when something big happens, and they can still get their care taken care of. Because right now people aren't going to the primary care docs because it's a lousy system now. It's got progressively worse over the last 10 years.
Mhm.
Where, you know, the doc has to see 30 patients a day and spending 5-10 minutes, go see someone, give them a pill, whether it works or not, move on to the next patient. You know, referral, drug, move on, referral, drug, and that's just crappy medicine. So I saw a note there from Gregory on the hydroxychloroquine, Z-Pak, and zinc treatment. I can go into way detail on that one, but yes, in a nutshell, it works.
Okay.
So I had a patient with leukemia I treated with it.
I see that Harvey asked a question about prescriptions. How do prescriptions work? And he commented that currently he's using a mail order prescription service.
There's a bunch of different ways you can get medicines cheaper. There's the long-term chronic meds, which is where some of the mail orders are really good. There's one called Scriptco. And for $10 a month, they'll give you all your drugs at wholesale cost that they get, straight pass through. So if you're on multiple drugs chronically, maybe like cholesterol medicine, heartburn medicine, allergy medicine, for example, you get 3 or more, that can actually be cheaper. You know, like, gosh, I think $200, $300 a year total. For really expensive drugs, let me get one thing about immediate drugs. Penicillin for strep throat. GoodRx, I think, is the best that I've seen, and I recommend that to patients. They get a wholesale cost. When you go to a pharmacist and you have an insurance plan, ask the cash price, the GoodRx price, and like HEB has their own plan first. Because if you tell them you have insurance, the pharmacist is bound to only give you that cost, because quite often they have non-disclosure agreements. They're not allowed to tell you how to get it cheaper. It's a screwy system. So GoodRx.com is, I think, one of the best. Some of the mail-in pharmacies for you have chronic meds, those can be pretty cheap. Now, what about those big costs? There's a new medicine called Eliquis, which we use for people who have blood clots and things like that. It's a great drug, very safe, breaks down blood clots, things like that. But it's $400 a month for 6 months. That's an expensive drug. Well, that's where the health share plans will actually start meet those temporary costs, or it starts meeting towards deductible. Some people have plans, and there's a couple companies are doing this, where they have a Sedera, a health share plan, direct primary care, and then they use elements of the minimally acceptable plans. Again, ask a broker, they know these more than I do, where you have vaccination coverage, preventive med coverage, and a prescription drug plan for a small amount of money. So that there's a couple different ways to avoid that. But what I hate to see is people are worried about that big expensive drug. Gee, I might have to spend $400 a month on a drug for 6 months, so I'm going to spend $500 more a month forever on an expensive bad insurance plan. So, you know, everyone's worried about that big expense coming down the road, so they spend more money now. Well, plan for it now, and then you have less cost down the road. But some of these plans, healthcare and insurance, there's bad guys in every system, hit you on the backside with the costs. So prescription drugs, you have to, you know, be a little foresight ahead. You can avoid those high costs too.
Great. Frank, before I get you, we had one more question that came up in the chat. So one of the ladies asked, what about women's yearly checkups like mammograms and that sort of thing?
Well, a couple things. One is mammogram screening ones can be done fairly cheaply, about $100, $150 at places. And in October, during Breast Cancer Awareness Month, many places do mammogram screening for free. So that's an important one to do. Also, in my practice for women's health, I have a PA who she used to work for me full-time in community care. Now she works for me part-time. She'll do my women's health. Pap smears only every 3 years, not every year. And the expensive cost with the women's health exam is really just the pap smear. And that is a pathology review, screening for a cervical cancer, gentlemen, for those who don't know. That's a $20 lab cost. So that's the only charge with that.
So the most exciting thing that you said and all that I saw some of the ladies actually cheer, like raise their hands and cheer, was that the pap smear only has to be every 3 years. You win today just for that. Frank, you had a question.
No,
or comments?
I just wanted to agree with the doctor about the pharmaceuticals. Um, I don't even have a pharmaceutical plan that I can sell you anymore. GoodRx has destroyed the pharmaceutical insurance business. GoodRx is not insurance, it's a discount program. But you don't care. It gets, you don't care what it is, a discount program, or because it does what it does what the doctor said. Know how much, get on the internet and know how much your pharmaceutical is going to cost before you go to the pharmacy. And when I say go to the pharmacy, I mean Sam's, Costco, Walmart, or HEB.
Yeah, I'll give you an example. The other day is a new medicine. There's 2 over-the-counter medicines that are new, but they've been prescription for a long time. One's called olopatadine. It's an eye drop, Patanol, and it was it's like $15. It's a great allergy eye drop, fantastic one. So now it's over the counter because it's not dangerous. I mean, the only way it's dangerous is you poke yourself in the eye with the dropper. But I gave a prescription for someone that a couple months ago, and now it's on the market. And she said, maybe I'll go and fill it. Walgreens was going to charge her $250 cash for something that's $15 down the corridor, 10 feet away. The other one's Voltaren, which is Voltaren cream, which is basically, it's like ibuprofen cream. It's great for arthritis, joints, sore hands and feet, and sprained ankles and stuff.
Thank you. Eric, you had a question.
Yes, Cliff, you kind of alluded to this a little bit. How does lifestyle and preventative care, or how does all of that kind of figure into this bigger picture?
My favorite line for people is there's 4 bases of medicine: healthy diet, exercise, clean living, do what your mama told you. Everyone's going, yeah, I made that mistake. But preventive is a really enormous part of it. And there's one advantage of this program is this type of model is that people have that preventive questions, preventive medicine type questions, or just want advice. Hey, I saw this new vitamin or this new supplement. Should I try it? That's where we can have a conversation and talk about it. And that type of conversation actually makes me better because people bring up things to me I didn't know about. They say I'd advertise somewhere else or doing some research and they ask me questions about it. And I'll actually, let's go look it up. Let's see if this is effective or not. So that's a big advantage, and it keeps people out of the hospital, and people come visit me when they're happy, not when they're miserable.
Right. What a novel concept, right?
Yeah.
Greg, I see your hand.
Yeah, along those lines, Dr. Porter, I have friends that have done really well with like Chinese holistic medicine and things. What's your opinion on that? Do you work with that, or do you? On
holistic medicine?
Yeah, or the Chinese herbs and stuff.
Holistic medicine means a whole variety of different things, and so some people use it in different terms. In one sense, holistic means bringing the whole concept of the body, spirit, mind, and stuff together, and that's the fundamentals of all medicine since my classmate Hippocrates. I'm kidding. He was a year ahead of me. But I mean, that's always there and should always be there. And you're speaking directly to a point in the current system where people have to go faster and faster. They're not taking the time to go through the whole person's, experience, their medical issues, how they're raised, their diet, all these different things. You just don't have time in traditional medicine anymore to do that. Now, if someone breaks their arm, medicine's straightforward. We're going to put in a cast and it's going to make certain it heals. That's pretty straightforward. But say something like hypertension. I got great hypertension drugs. Do I need to use it first? What's causing the hypertension? Well, every time I come to the doctor's office, it's white coat syndrome. No, it isn't. You had 3 cappuccinos and an Adderall before you came in. Of course your blood pressure's high. Is the blood pressure really just episodic because it goes up and down like this? Is it a lifestyle issue? Partly. Is it genetics? Yeah, always blame your parents, by the way. So, cholesterol itself. You can eat like a pigeon, your cholesterol can still be extremely high. That's genetics. You can eat terrible and have low cholesterol, and that's thank your parents. So the holistic part of it, that's what we can, getting the whole picture. In terms of Eastern medicine, certain things coming out of Eastern medicine and Western medicine combined, that's where we're doing research, especially on the effects, like herbal medicine, they're drugs. I mean, whatever, we get a lot of drugs are. Penicillin is a natural substance that we've developed over time. So all these things go together. Acupuncture, or dry needling, which physical therapists call it, there's a lot of debate about that, but I've seen it work. I've tried it on, I get muscle knots right there. I've tried dry needling, it doesn't work for me. A friend of mine has the almost exact same condition and it works great. And he's not a believer in it, so it actually works. So there's things we don't understand in medicine. We say we don't understand half of medicine, we're just not certain which half.
I have heard that before. We had one last question, Cliff. Angie asked if you would comment again on what you think is the best cocktail to treat or prevent COVID. I think she's talking about when you were talking about Greg's question earlier.
Oh, the hydroxychloroquine. I have a patient who's been on this for years for autoimmune type disorder. And so we studied this early to see if she's at risk, and we found out she wasn't based on SARS back in 2002-3. Real quick, and explain why this works well. SARS, well, the coronavirus attaches to what's called the ACE2 receptor. All viruses do this. They attach to one of the receptors on your cells to get into your cell and steal your DNA to replicate and then spread and just expand as fast as possible. So the ACE2 receptor is more common as you get older. That's why kids aren't getting sick. They just don't have as much. Hypertension, emphysema, poorly controlled diabetes, you get more of them. So hydroxychloroquine, chloroquine hinder the virus's ability to attach to the ACE2 receptor. So it slows it down. So the earlier you use it, the better. Hydroxychloroquine and azithromycin and zinc all also change the pH inside the cell. And so that slows down the virus ability to replicate. So it's slowing it down to allow your white blood cell system to work. Interesting thing about zinc though, zinc at high doses doesn't penetrate into your cells. It works in vitro, not in vivo. That means it works in the petri dish, but it doesn't work in real people that well. It's a 2+ ion, so it needs help to get into your cell. So it has to piggyback on another molecule to get in your cell and work. What's one of those molecules that it uses to piggyback? Hydroxychloroquine. So you use them all together. I had an interesting circumstance where a patient I got him the hydroxychloroquine, but they didn't have zinc at the local store. So I went and got some, I have some here. So I got some baggies, put a bunch of zinc in it and took it over in my direction. I felt like I was handing out a dime bag of zinc, taking it over to this patient's house. It was like a real drug dealer handing out zinc, but very high doses that actually worked well together.
Why are doctors being banned and censored? Why are doctors being banned and censored for saying exactly what you just said?
I hear it's a political year. So.
Oh yeah, it's a hypothetical. Yeah.
It's extremely frustrating, the political interference in medicine. Extremely frustrating, and people see these and low-income uninsured populations who have to rely on government-type medicine like community care. They're not using it, and they have a higher mortality rate. It's really frustrating. I twisted my ankle jumping off my soapbox there.
Do you have the hydroxa, whatever at your office, or? Yeah, does the pharmacies fill your prescriptions?
Yeah. Yeah, I work, there's a couple local places, HB, and I've had a bunch of pharmacists. We've talked and had some pretty good conversations. Some of these guys are really good that we work with. I had one guy give me pushback on preventive treatment. He says, well, I've heard it wasn't. Well, there's a website called C19study.com, which goes through all the different studies throughout the world, and the vast majority of them shows us positive. Now, there's some that don't, like you use it late, you do it the wrong type population base, what are the drugs? It's a complex thing. It's not a cure, but it's a very effective, cheap treatment early on that's going to help people survive. It's a very frustrating thing.
In other countries.
Could you repeat that? CE, is that what you said, C?
C19study.com.
Dr. Porter, if you're comfortable doing so, will you pop that website into the chat? That way, if people
that makes sense. And I type it, not even writing it, so you can't see my handwriting.
There we go. There you go. Well, I know that there may be other comments or questions, but I need to be a good steward of our time today. So, Cliff, thank you so much for being with us. It was a fantastic presentation.
Thanks, guys. Thanks for having me, Mike.
Yeah, both your prepared comments and your Q&A, fabulous. I suspect that you'll be getting some contacts from people.